Hi, everyone. Thank you for joining us, and welcome to another episode of the Social Critic. My name is Sohail Shakeri, and today it is my great pleasure and honor to welcome a special guest, Mr. Roman Bystrianyk.
You pronounced
Roman.
that correctly too. That's
Oh,
good.
thank you. Thank you. Yes. All right. Kudos. Woohoo. So, yeah, I'm excited to have Roman, and we're going to be diving into the history of vaccination, his great book that he wrote, which I'll be showing in a few moments, as well as some other exciting projects that Roman is working on, which are really important from a civilizational point of view as far as where we are, humanity and our global civilization. So I'm really excited to have Roman here. And so I'll just read a quick background about Roman so you all know his background, and then we'll jump right into it. Roman Bystrianyk is a researcher with an interest in disease and vaccines, nutrition and alternative medicine, history, science, environment, spirituality, and the nature of our existence. He has a BS in engineering and an MS in computer science. He's currently working on 2 books, one on the serious problems with our environment, and one on his recent experience with the loss of his wife, grieving, and his evolving spiritual path. And Roman is the co-author of Dissolving Illusions, Disease, Vaccines, and the Forgotten History. So if you have not already gotten this book, I highly encourage you to purchase it, read it. It's a terrific read, and it's a very empowering book that really allows for one to have strength in one's understanding of modern medicine, vaccinations, and just the whole trajectory of how we've gotten to where we are. So with that, hi, Roman. Thank you for joining me.
Well, thanks for having me for this little chat.
My pleasure.
Yeah, I put together some notes, and I have some quotes and references that I can share as we go along. I like to, when I have quotes, I like to make them right instead of just
For
turning
sure.
So I wrote a bunch of stuff down, so that'll be easier. And if anyone wants any of the references or any of that information, I have some proto chapters of my new stuff. And if they just want to email me at my name, romanbystrianyk@gmail.com, or Moving Back from Midnight, which is the working title for my new book. That's also at gmail.com.
Fantastic. Great. Thank you.
So just kind of to mention, the book is really a collaborative effort, right? So there's like countless people that were involved with collecting data that I was able to access. There's, hundreds of scientists that wrote and historians that wrote books and articles and all that stuff, and I was able to read that. I had Suzanne Humphreys, who is one of the most honest, wonderful people you could ever meet. She's a hard worker. She gave up a 6-figure career to just pursue the truth. So that was brilliant woman. So fortunate to work with her. And then I had lots of people in my life. Meryl, who was my wife, who I never would have got this done without her love and support. And my mom and dad, of course, who are just awesome parents, and they made me who I am today. And there's just so many people that were involved. So we're just we're the end people of the whole thing, really. So I was just one of many, really. So even though my name's on it, there was a lot of people involved in making this happen.
Wow. No, that's great awareness. No, thank you for sharing that. Wonderful. Excellent. So Roman, can you tell us how you started researching the topic of vaccines to begin with? So what put you down this path?
Yeah, well, there's a lot of different things that happen in your life, right? So I had gotten into alternative medicine from a friend of mine because I was having a couple medical problems. I was working at a software medical company, and I was having what I would call, well, chronic fatigue, and I didn't know what they were. Hypoglycemia is one of them, so I called them sugar crashes. And so I ended up talking to my coworker, and he's like, well, you know, you're probably hypoglycemic. You should read this book. And I was like, oh, like, okay. You know, I don't know anything about this stuff. I'm just a regular dude, engineer, software guy. But I had, you know, I was kind of curious. So I read through this book and I was like, wow, that's interesting. There's a lot of very different stuff in here about nutrients and that. And it's like, well, why do I know that? I should know that. I went to school. I went to college. You know, I watch television. I should know this stuff. I should have heard of it. At the time, I also had access to the medical library at the company. So I was able to go through some medical journals and read stuff that I was lucky to have. So I started doing that and I was like, wow, you know, there's a lot of stuff in here I've never heard about before. The studies on vitamin C helping with this condition. I gravitated toward the nutritional stuff because that was, you know, something on my radar. And the more I saw this information, I just couldn't fit. I felt I should know it. I should know that it should be getting out to the public, or at least me. You know, how come I didn't hear about this stuff? I should know this. I have an education. So I found it very strange but eye-opening. And you know, but I always had an innate curiosity, so I just kept on digging into stuff, and I just kept on reading more and more of these journal articles. And you know, I kind of evolved my understanding of nutrition and health to some extent, and I, you know, just kind of dove into that. And it you know, it was really just kind of this moment where I'm like, oh, everything that I thought I knew, maybe I didn't really know, because here's all this information that I'm getting that just wasn't out there. So at the time I had kids, I was married, and I was listening to some radio programs as well, and I heard some programs on, and this is a number of years ago, vaccines that, you know, were a little suspicious. They were talking about autism and maybe brain damage. So I'm like, oh, that's interesting. Never heard about that either. And
when was this?
I don't want to say it because then I'll be old.
Okay.
So
yeah,
was
2000s.
Early, was it 1990s? 2000? It was a long time ago. Wait,
Gotcha.
yeah, it would be. Yeah, it'd be 1990s.
Okay.
To 2000s. Anyway, so yeah, let's call it 1990s, late 1990s.
Yeah.
And so I heard that. I was like, oh, you know, at the time I thought, well, that might be true, and that would be sad, but that's probably rare. But on the whole, I knew that vaccines saved us from, you know, all these massive deadly plagues. And so, you know, they happened in the past. We invented vaccines, or somebody did, and that was a good thing. So on balance, you know, okay. But I was still curious, and I picked up a couple of books and a couple different research articles. And what's interesting is I had no idea where this belief I had about vaccines came from. I don't remember ever being taught it, but I was very certain of it, that, you know, there was these massive plagues, and then vaccines came along, and now we don't have massive plagues. I still don't know where that thought came from, or that belief, because it was pretty ingrained. So I don't know where that came from. But anyway, so I picked up these books and medical journals, and I was reading through them. And there was a small booklet by, which I think I still have somewhere, by Neal Miller. It's a very tiny booklet, really. And in there, as I was reading through it, I came across this chart on measles death rate. And in it, it showed that measles death rate had fallen by 95% before the vaccine came into use. So I'm looking at that, I'm like, I thought at the time, I thought, it's like, that can't be true. Like, no, maybe this guy just made it up to sell his book. I don't know. It just didn't make any sense to me. It just defied what I already knew to be true, or at least I thought it knew to be true. But I was curious, and curiosity always gets the best of me. And so I went to my local library, just probably the Orange Library in Connecticut or somewhere like that. And I picked up a few almanac books, and I was just paging through them, trying to find mortality statistics. And, you know, I didn't know anything about any of this kind of stuff back then. I went through the first couple and I didn't find what I wanted. And I finally found one that had measles deaths every 10 years, starting in 1900. So this is obviously dated. I took a piece of graph paper out and I plotted the points, and I took a little protractor or a ruler and then I connected the dots. And I just sat there. I remember sitting there in the library just with my mouth open, and I was just dumbfounded. It's like, here was the same chart that was in Miller's book. And It was one of those, oh, wow, that's true. That means what I thought was true, which I was sure was true, not really true, at least for measles anyway, right? So I was like, it was one of those moments you don't forget because it's just such a shock.
Yeah.
But then after that shock died down, I was wondered, where did they get that data from? So I was close to Yale Medical Library down in New Haven. So I decided to go there and see what I could find. And it's funny, I remember saying, well, I don't know if they can let me in the library, but I just went to the front desk and I figured they might not let me in, but I just went in and said, I asked the guard, I'm here to access the library. And he just very nicely let me sign in, gave me a guest sticker, and I was in. And I just acted like I belonged there, and nobody ever gave me a hard time. And I must have gone there 1,000 times. Well, maybe not 1,000, hundreds of times.
Wow.
Quite a few times. I was probably in Yale Medical Library over the years more than almost anybody. Because they had those, and then they had a historical section, and then they had downstairs like every journal you can imagine. It was huge, just like a warehouse of journals from way back when to whenever. You could just spend your life reading it and you wouldn't get through much of it. It was huge. So I could find anything I really wanted. That's before everything went online. Anyway, so on the top floor, there was volumes of US vital statistics, and I went through those books, photocopying the parts that I wanted for mortality statistics, because they were just scattered through all these different volumes. And I put them all into my folder and then eventually in a binder, which I still have. And I took them home and I punched them into Excel spreadsheet. And so then I had every year from 1900, when they started gathering statistics, all the way to the present time. And yeah, I was, it confirmed Miller's data and what I found in the almanac, that measles had declined by 98% before the vaccine.
Wow.
And, well, it's important to know that's the mortality statistics, not the incident rate. But still, that was something that I just almost couldn't accept, even though I have this data in front of me. And then there was another, oh, wow moment. Did the same thing with whooping cough, and it was the same thing. It was 90% mortality decline before the vaccine. And that was primarily because the vaccine was introduced in the mid 40s. So I wouldn't be surprised if it had declined by 98% in 1960, if that's when the vaccine came out, but the vaccine came out earlier.
Gotcha, okay.
And these are some of the charts that you see in the book, or they're available online too at dissolvingillusions.com. So you can just go over and click on graphs, and you can see all these graphs in nice full color instead of black and white in the book. And so they're all there. So you can just look through those. And it takes a long time to put those little, go through all these pages and put them into the chart. So it took a while, and I became obsessive about it. So
yeah, no, those graphs were great. I mean, I've really used and benefit from those. It's just really like a visual like that where you're talking about the death rates. I mean, it's just really really eye-opening. Like
that was the aha, oh wow moments when I saw those charts, and those really meant a lot to me. And so I decided, that's the United States. I started looking at other places, and I found England, and they started gathering statistics in 1838. And so that took a lot longer to get that data. And there's even now in those charts, you'll see this thing called data gaps, which I wasn't able to get those years. So there's little gaps in the data. Not a lot, but there's some. And, I started putting that together. And I found that, England started their vaccinations in 1968. So I'm looking, and measles is horrible, as well as all these other infectious diseases in the 1800s. I mean, they were people were dropping like flies from measles and whooping cough and scarlet fever and tuberculosis and all these different types of things. And in the case of measles, the rate of death was 30 to 70 per 100,000. You always normalize to, you know, some number so that you can compare. And but like in the mid to late 1800s, more towards the late, the rate started to drop and fell really quite far by 1968 by really almost 100%. Almost nobody was dying by measles in 1968 in England. So here you go. Here's another piece of data. And I also got data from various states like Washington State and these different places. And, you know, they all showed the same thing. I also had part data from Sweden and other places, but I never really had a good chunk of data there, so they never made it into the book. I actually have probably another 50 different charts in a spreadsheet, but they weren't that substantial, so I just kind of let those go. So, and there was also another disease, Scarlet Fever, and that was a massive killer. That was called the Fell Destroyer. By almost everybody knew somebody who died from Scarlet Fever.
Oh wow!
It was a big killer, and that was in the range of 50 to 160 per 100,000. So it was a big baddie, and eventually that dropped to near zero by the 1940s, and there was no vaccine for that, which was another curious thing. And then that's a bacterial disease. Measles is viral. Whooping cough is bacterial.
Okay.
That was, so they're classified as that. So, you know, with all this data, I was like, something else is going on here. And I was, you know, I knew it wasn't the vaccines, couldn't be the vaccines. Maybe they decreased incident rate. Okay. But they didn't decrease the mortality unless they can travel through time, which I don't think they did. So it wasn't true. It couldn't be true. It was just data was crystal clear. So at that point, I was like, well, what did make the changes then? And I started digging into that. And, you know, I'm looking through all this historical documentation on just how horrible life was in the 1800s. It wasn't this fantasy with people twirling parasols and top hats and all that stuff. You know, most people did not live that well. It was abysmal. Just overcrowded cities, no sewer systems, no fresh water. People ate rotten food. There was children working in factories, overstressed. This is horrible. You went to the bathroom, you just threw it out the window, and it went to the streets, and that mixed with your water supply. So, you know, it's amazing to me anybody even survived this, and especially in the big cities like New York City and London, it was just horrifying, and it was polluted because all the industries were all mixed. And it wasn't like today you can just order some food from someplace and it's, you know, shipped in. It wasn't. It was, you know, the animals were brought into the cities and slaughtered there, and just the blood and the, you know, excrement from the animals and the humans all mixing together and basically raining out into the water supply, and then you get to drink it. And because what else are you going to drink? You're not going to you're not going to get bottled water down at your local store. So and then as you read through forward in history, things changed. You had all these developments that a lot of people fought for. A lot of people fought for labor laws for children first, and labor laws in general that we all more or less take for granted now. I mean, there's still parts of the world that, you know, children are still basically slaves, but in the Western world, you know, we got rid of that. But a lot of people fought for that, and people fought for, you know, sanitation, hygiene, and piped water, and all these, you know, great public works. And, you know, and then we had innovations that came in, electricity and chlorine to clean the water supply, and all these other things came in. And as these things all came in, the rates of all these diseases all simultaneously dropped. And it took decades, but on the chart, it looks pretty dramatic. You see it just all of them going together. And I think there's some charts in the book that show the diseases all basically going down together in mortality. So, you know, by the mid 1900s, you know, these things were not considered much of a problem at all. So, but that's when we decided we're going to vaccinate people for various things. But you know, that's kind of the history that was revealed to me.
Wow. Basically, just it really puts the whole foundation of the argument that, you know, vaccines have saved, you know, millions and millions of lives, and they've basically been the saving grace for our civilization. It just puts that whole thought, belief under question.
So I didn't start out to write a book or anything. I just wanted to know what was best for my kids, and I was curious what this radio program had said and what this guy had in this book, and it just drove me into looking at all this stuff. And I'm a little obsessive sometimes, so I just kept on going and going and reading, and I was just, you know, just the more I read about various things, I was like, wow, that's crazy. You know, how many people were starving to death during 1 year, or, you know, and it's like, wow, is it really that bad? It was just horrifying. I can't even imagine horrifyingly bad it was. And so, you know, you had all these factors that I just didn't know about, and it was just, I was just fascinated with the whole thing. And so I just kept on accumulating data. Then, you know, eventually I started assembling some kind of book.
Wow, unbelievable. Great. Yeah, thank you for sharing that. And so, in relation to the book, so you mentioned, you know, your co-author, Dr. Suzanne Humphreys.
Yeah.
And I was wondering if you could tell us a little about, you know, how you know, decided that you needed to contact her, because you were the one who had started writing the book, and then you contacted her to write it together. So can you tell us about how that came about?
Yeah, so I originally started writing a book. I think it was either my original working title was Out of the Pits of Hell or something like that. And so I had an outline. I started writing chapters, and then I dropped it. I was like, I'm not going to write this. You know, I don't know what I'm doing. I have other things to do in my life, you know, so I just dropped it. So then sometime later, I picked it up again, and you know, started more, you know, really focused on it. And I wrote actually a few chapters, probably like half a dozen, maybe 10 chapters that I had basically prototyped. And but I knew I needed to have a, you know, co-author with a medical degree or a PhD or something, and I just didn't know where I was going to find that person. I had no idea, but I knew I needed that. I knew that I had to find that, and I knew I would, which is weird because I don't know how I knew that.
Wow.
So so one day I'm listening to a radio program. I think it must have been Gary Null out of New York City, but not positive anyway. And I heard this doctor talking about smallpox, and I'm listening, and she's like saying a lot of these things about smallpox that I'm like, oh yeah, that's right. Okay, I've been reading that. Yeah. And right then I knew that this person, Suzanne, was the person I was looking for. I didn't have any doubt. I was just like, oh, there's my co-author.
Oh, wow.
I don't know how I knew that, but I knew it was going to be, and that she was going to do that. And after the show, I called her, and she never returned the call. And so I tried a second time, and she didn't return my call either. And then I called her a third time, and that time she returned the call. And she goes, well, I thought you were probably one of these quackbuster people that are really angry at me and give me a hard time. I said, no, I'm writing a book on this, and I thought you might be interested in working on this. So anyway, she agreed that I could come up to Maine. Meryl and I drove up to Maine. We turned it into a park vacation, and we met her at her house. And she had a partner, and there was a couple of dogs there, and we had a really nice time. And we got to know each other a little bit. And then we went to some lake or someplace, and I brought my little binder proudly, and I was like, oh, I got a doctor to read my stuff. And so I brought my proto chapters, and you know, she read through this, and you know, she's like, yeah, okay, let's work on this. So we spent the next 4 or so years working on it. And she spent some time with us at different points. We spent some time up there, and then, you know, we could do through email, but she spent some time down in Connecticut with me too, so with us, and that's how that all happened.
Wow, how exciting!
It was very strange how I knew all these things. It's when I think about it, and it's just strange how it just all seemed to happen the way it should happen. Which sounds kind of
Yeah.
crazy, but yeah,
No,
but it
I
did.
love that. It's like this intuition was just guiding you, and it just like
Yeah,
you were certain.
that's kind of it's kind of playing into what I'm experiencing in my life now. So, but we can maybe talk about that later. But
Oh wow, yeah, no, that'd be
everything is just intuition, and it's kind of sounds magical, but I guess it is, and it seems to work pretty well actually.
that is wonderful to hear. Wow. Yeah, life based on intuition. My goodness. I hope.
Yeah, it's a different way to do things, and I guess I've been doing it for a while without even thinking about it, which and it seems to kind of pan out most of the time, actually, almost all the time, actually.
Wow, fantastic. Thank you so much. Great. Yeah, and then I was wondering if you could also, tell us a little about, how your work on vaccines, uh, and you've touched on this a little bit, but how it's led to a change in perspective for you about how to maintain optimal health.
Right. So I had a bit of a background, not any kind of training per se, but I did attend some courses in New York City with Gary Null and a bunch of different people there. And I kept on reading books and reading medical articles. A lot of this stuff's in the medical literature, which is just amazing. There's tons of stuff about nutrients that's all in the medical literature that you wouldn't think is there, but the way you hear stuff in newspapers and on TV. But there's lots and lots of stuff there. So if you want to spend the time to read through these things and understand them, because sometimes they get technical, but so you have to spend the time to understand the terms, and it's just amazing what's in there. All sorts of things about green tea for all sorts of conditions, for example. It's just tons of it.
Oh, wow.
But as far as the book goes, I realized there was, a lot of illusions that I thought were true, and I found out they're not true. And by the way, Meryl thought of the title of the book, "Dissolving Illusions," so that was her title, and I really thank her for that. I thought it was a brilliant title.
It is. Yeah, it draws you in.
Here's another person that contributed something to it. I didn't do that. Anyway, so there's all these things that were in there, and even in the book, there's Dr. Klenner in the 40s who was able to treat polio and herpes and measles with large doses of vitamin C. And
Wow.
it was 1,000 milligrams of vitamin C given every 2 hours, all evidence of an infection clear in 48 hours. And that was in 1949. He wrote a article about that, the treatment of polio and other virus diseases with vitamin C. And it's funny, in his work, he calls it a drug, right? Because of course you kind of thought of it as some kind of external drug. And so back in 1949, 1950, we had a cure for these problems. Measles. There's several instances in that study where he gave certain children that had full-blown measles, just made sure they had lemon and lime juice and they got vitamin C around the clock, and they were all fine within a couple days. And it's like, why didn't we follow that model? We could have followed that model and we wouldn't have all these vaccines. Vaccines wouldn't be an issue. Kids would be immune for life. And I think we went down the wrong path 70 years ago. But we are where we are now. But we just kind of ignored certain pieces of work that we didn't really like. And when I put all these things together, I just I don't really go to doctors. I just follow what I think is legitimate. I look through the medical literature. I know several doctors that actually do the same thing. Sometimes they practice and sometimes they don't. But there's a lot of people that follow the alternative. I know a lot of nurses that do the same thing. They might work in the industry, but they don't follow what the industry tells them to do, because they've discovered that there's problems with medications and all these procedures, when a lot of times you can just do things through diet and exercise and nutrients. And so, all these different life experiences in writing the book, led me down that path. There's also a section in the book at the end that has all these, what do I call it, lost cures, lost remedies, I think it was. And so there's all these different things like colloidal silver and garlic. Garlic was great against bacterial infections. That was like one of the #1 things. Great. Oh, wow. Yeah, it was considered one of the best before we decided to go down the antibiotic route. So if somebody has infections or loading up on garlic, it's like, holy cow, that's really pretty effective. As a matter, I remember being sick or starting to get sick one day 15 years ago. So I decided I'll make a garlic juice and some lemon in it. And so I made it, took a whole bulb, juiced it, and I sat down and took a shot of it. Don't do that. Don't do that. I thought my stomach fell through the floor. Yeah, definitely dilute it down if you ever do anything like that. And but the sickness I was feeling coming on was instantly gone. It was just wiped out. Just went away just like that. After I picked myself up off the floor because my stomach went into shock just doing all that garlic. But so, you know, there's these things you can do that you don't have to go to the doctor for everything. As a matter of fact, I don't think you should go to the doctor for much of anything unless you break your leg. But you know, so, you know, all these different experiences and all the reading and research, you know, just led me down that path of, you know, taking control of your own health. I think that's important.
For sure. Yeah, very empowering. So it's like we're able then to take our health into our own hands.
Yeah, I think as a society we're trained, and I know a lot of people that do this. It's like, my kid is sick, I'm taking him or her to the doctor. I'm not feeling well, I'm going to go to the doctor.
Right.
Et cetera, et cetera. It's like, why are you doing that? Why don't you try this? You know, I have a headache all the time. I have a doctor, but you drink lots of coffee and no water. How about if you try rehydrating? And I've had people do these things. It's like they start drinking lots of water and all of a sudden their headache that they've had all the time goes away because they're dehydrated. You know, all these simple things that you could do that I'm like, why don't you try this? It's easy, it can't cause any harm. And if it doesn't help, then you can go to the doctor. And quite a few times people are like, oh, yeah, that worked. You know, I don't have to go to the doctor. Well, that's the point. You have to be empowered. And we as a society largely don't empower people to, you know, solve your own problems, try to figure it out, research your own stuff. Instead, we defer to the medical system and we just say, hey, you take care of it. I don't have to do anything. Yeah, it's easier. It's easier and it's good for the doctors. It's good for the patients because you don't have to do anything. It's good for lots of profits throughout the system. But is it really, really the right way to do it? I don't think so.
A great point. Thank you. Excellent. All right. And so I want to transition a little bit from the history of vaccines and the different ways that we can take care of ourselves from a health perspective to the current situation that we have, with the coronavirus, the lockdown,
Sure.
the medical approach of our governmental authorities. What relevance would you say that your book has with regards to helping someone better navigate the terrain of the coronavirus lockdown measures that we're seeing across the world, really?
Yeah, so I think I'll talk a little bit about this. So coronavirus. So when I was looking into measles, I tried to find in medical literature where they might talk about the mortality decline, and there was virtually nothing. And all these articles I read, they didn't talk about that. There was one 1980 paper in Journal of Public Health, American Journal of Public Health, and it showed that on a logarithmic chart that there was a small change in death after the vaccines. Of course, the chart shows a big drop, but that's on a logarithmic scale. It's essentially the same chart I have, but my chart's on a regular scale. And what the authors missed was the 98% decline in mortality before the vaccine. They just missed it. I don't know if they did it intentionally or not, but they just missed it. And there was no mention, as I imagine if they had, because since then we've had an obsession with a vaccine to handle that disease. And which was not much of a problem by the 1960s, really. In 1962, measles deaths were rare. Like in New England, the 5 New England states, there were only 16 deaths in 1962. There just wasn't that many people dying. There were some states with 0 deaths. But we started going down this route, rightly or wrongly, because incident rate dropped, okay. But, there was a lot of problems with it. They always had problems with the vaccine, and they needed to have, eventually decided they have to reformulate it from the original one in 1963, and they had to change it in 1967 because that 1963 vaccine was damaging. But in any case, there was a lot of starts and stops. In 1967, they thought they were going to get rid of measles altogether, just had to vaccinate the right number of children and everything would have been done and we would have been done with it. Well, of course, that never happened. So now it's crept into everybody's life that you have to have, I think it's currently 2 doses. I haven't been following it, but 2 doses of measles vaccine. And so, we're all indoctrinated into this belief that we need to have these vaccines. And that's the thing that most people, including myself, including Suzanne, everybody I know, originally thought that's what you had to do. That's what you believed, right? And but no one knows now any of the history and what you can do to handle measles very easily. And since virtually no one knows, whenever there's some measles cases, and you can see that there's a virtual panic. There's a panic in the media. There's panic. People are out there with pitchforks and torches. Well, not really, but right. Because they're angry at the people who didn't vaccinate. It's because they're in a fear. They're in a fear that because some people didn't vaccinate, that we're going to have millions of deaths now, like we did way back when, until the vaccines came along. Of course, that's not really true, but that's the fear that gets embedded. And because we haven't addressed that fear in a rational way, we're trained as a society to panic on any infection that doesn't have a vaccine. So vaccines are a magic wand that takes care of everything. And without that, nothing else can be done. We can't do anything. It's like, what are we going to do? Oh, we don't have a vaccine. Well, we all have to panic. And it's because of this embedded psychology in our public that we're going to return to millions of deaths. And so we could have millions of deaths if we don't vaccinate. And there's nothing else we could do. It's an illusion, but it's pervasive, and it's a fear. The fear is massive, and if you've seen, the reaction to whenever there's a measles outbreak, you can see that the fear playing out all the time.
Yes, no, I definitely see it. Yeah, I live close to Disneyland, and so I've seen it for whole Disneyland outbreak.
That wasn't even an outbreak. These are scattering of little cases, and it's like all of a sudden it's like outbreak. We're all going to die, basically. And it's just not real. It's just fictional, but it's real to most people, like it was to me, like it was to Suzanne, and to other people. They're like, you just believe that's true, and most people still believe it's true. So I think if we weren't panicked by measles, then when we had this problem, we would have reacted in a rational way, but we didn't. And so that's one of the huge downsides of vaccines, is that it disables people from, doing anything else. The establishment could say, well, okay, you vaccinated or you didn't vaccinate, but if you get measles, you could do vitamin A and vitamin C. You could do these things like they did back in the 50s. So, at least we have an alternative, just in case, you don't want the vaccine. All right, fine, you should, but at least you could do this, but that's never mentioned. So it's always either you do this or we're doomed. And it's because of that psychology, when this started happening, the fear propagated so fast, and the fear and panic. And so I think it's this psychology that we have to deal with, and understanding some history and some look at actual data, instead of just, just thinking that, gee, we have a disease, vaccine, that's it, nothing else.
Right.
But then I was thinking a while back, there's something deeper. So when you look at these charts of statistics of measles deaths, and you see the measles declining to 0 or near 0, it's like, so what does that chart really mean? What happened? And there's a lot of things that happened. So we talked about Dr. Klenner taking care of measles. We know that vitamin A reduces mortality because they did this in Africa by 60 to 90%, just vitamin A, large doses of vitamin A. So, you know, so you think about it. So what happened, or, you know, we talked about that a little bit. As far as changes in society, what changed? We had child labor laws, so children weren't working in mines and factories anymore. Housing improved from slums that they were. Sanitation and hygiene were radically improved. I mean, the streets were covered with human waste and animal waste. That's pretty bad.
Yeah.
Food was sometimes horrible or rotting. So, you know, and that's being replaced with nutritious food, because now we have electricity coming in. So then eventually we had ice boxes and refrigerators. And doctors were finally washing their hands, because in the beginning they thought that was, you know, quackery, that you shouldn't be washing your hands, and they didn't care to do it. And yeah, so they thought that was ridiculous, you know, but eventually they did. So, you know, a lot of things came in, the use of chlorine in the water systems, you know, all these public works, all these things, these all happened at the same time. And so that's where you see the chart going down, right? And so, so what does that mean here? You know, Mark Twain, of course, right? He's pretty famous. And he said there's 3 kinds of lies: lies, damn lies, and statistics. So the way I look at this now is, and I didn't look at this when I wrote the book, but we like to count things in a simple way. And when we see, oh, you got measles and you died from measles, we're going to count that as a measles. But in reality, that's an oversimplification, because you think, you know, you think you die just from measles, but you really don't. You die because you're malnourished, you live in a slum, you're a child working, you're stressed, you effectively live in a sewer, your mother is malnourished, et cetera, et cetera. So the measles mortality chart is really not a measles mortality chart. It's really a chart of all these factors. Someone didn't just die from measles, because if you're healthy and you got measles, people weren't dying in 1950, 1960. So it's all the different factors that compose that chart, which of course is a much more complex way to look at it. It's not just,
Right.
oh, I got measles and I died. So I think we've been looking at these numbers in a simple way that aren't reality. And I think that causes us to think of infectious disease as, I am this person and here's this virus and the virus will kill me, instead of what are all, you know, what's the whole totality of it? Do you see what I'm saying?
Yeah. Yeah. So instead of just isolating one factor and just trying to say, oh, okay, you know, I got this, you know, virus or this disease, I'm going to die unless I get this vaccine. It's like, well, there's other factors, you know, there's health, there's
so
water, clean water.
Right. So what we've done in these mortality statistics is we pick the thing that we think is the most important thing, and we check it off and say they died from that. But nobody went and said, well, I wonder if they were vitamin A deficient, right? We don't know, you know, what other health status. Maybe they have a bacterial infection at the same time. So it's a very simple way to actually count things, and ultimately it's not really true. Measles is just a factor, right? It's not, you know, the one thing that gets you. Okay.
Gotcha.
So, you know what I'm saying?
I do. No, thank you. Very insightful.
So it's a little different way to look at it. And so how does that work with, you know, the Mark Twain quote and what we're doing currently? So, you know, we hear all the statistics. I don't really watch TV anymore, because it's like, why am I going to watch that stuff? I haven't watched for quite a while now. It's like, okay, that's not true, and that's not true. I just get tired of it. And so, you know, so they're talking about all these statistics, and that's one of the big 3 lies, right? And so there were some articles out on vitamin D that came out that you may have seen, and there was an article in Science Daily. Yeah, so they cut, the doctors in that article said they could cut the COVID-19 mortality by 50%. And they talked about how there was a strong correlation between vitamin D levels and the cytokine storm. The cytokine storm is like this hyperinflammatory condition, which, caused by an overactive immune system. And so it's like, wow, okay, so there's vitamin D that could be affecting the mortality statistics, right? And vitamin D, if you look through some other articles, you find that could cut the flu by 50%, that's huge too.
Yeah.
So basically it's modifying the entire immune system, modifying the environment. And then we also know there's studies that show that people are deficient in vitamin D. So we know they're deficient. And a 2018 study showed that most patients were deficient in vitamin D, and 40% were severely or very deficient. And so you have all these people, especially elderly and dark-skinned people, because the darker your skin, the less you're making vitamin D. And so we have these values because of lack of sunshine or dietary intake, which is a consequence of indoor sedentary lifestyles and poor diets, as well as according to, I can't remember her name, she was talking about that. If you're dark-skinned and you move to a northern climate, your skin is adapted to making less because you're getting more radiation. So when you go up north, you're going to make less vitamin D. So now you're being more susceptible than somebody with lighter skin, which is kind of interesting. So that kind of explains some of the statistics that you see of people, African-American or darker skinned people having increased mortality rates in various places, especially in the north.
Oh, okay.
Anyway, so just as a kind of a thought experiment, so imagine if we focused on vitamin D deficiency and the media reported on that every day. So, CNN or Fox, or take your political flavor of the day, right. And they said, oh, another 3 people died today in this hospital. We tested their vitamin D levels and they were all deficient. We have an epidemic of vitamin D deficiency. And it's like, and they repeated that every day. After a while, people would be like, oh shit, there's a lot of vitamin D deficiency in the world. Oh wow, we got to do something about that. Maybe we can come up with a vaccine for vitamin D deficiency. Who knows?
Right.
So you see, it's the emphasis of what we're looking at. So we're not looking at that in general. We're not making sure everybody gets a vitamin D test. We're making sure everybody gets a coronavirus test, when more than likely we could cut down mortality by 50% just by doing, taking vitamin D, making sure people had enough adequate sunshine. And, we tend to warehouse our elderly in these buildings. And some people get sunshine, but a lot of people probably don't. They're stuck in the rooms all day. How are they going to get enough vitamin D? Of course, now they're going to be more susceptible to any kind of respiratory infection because we've set up this situation. But then it gets more complicated because you need magnesium to activate vitamin D. And the way we raise food has caused our dietary magnesium levels drop by 25 to 80%. And so you have like 75% of the population deficient in magnesium. So maybe we should be looking at vitamin D and magnesium, right? So did the person in part die because of magnesium deficient diet? Would that be part of the chart if you were to chart these deaths? Would they be COVID, vitamin D, magnesium? So now you've added these factors into it. Just like the measles isn't just measles, it's all these different things. So if you take all these things into account, that chart now is a different kind of chart. It's not just a COVID-19 chart or COVID-19 statistics. If we were looking at all these factors, we'd be saying the person died from these 3 factors. You know what I'm going with that?
Yeah. No, that's.
So it's a different way to look at things. It's a little bit more complicated, right, but I think it's more reality.
Yeah, it's more. I was gonna say it's more realistic. It's more holistic. It's right. Like
Well, I think it's
more
reality.
Complete picture. Yeah.
Yeah, it's reality. And then you can add in pollution levels, right? We know that pollution is a bad problem. As a matter of fact, 9 million people across the planet, which is 1/6 of the population, die because of air, water, and land pollution, mostly air.
Which is
related to
1/6 of what population?
1/6 of the deaths every year are because of pollution across
Wow.
the planet. Yeah, 9 million people. Of course, we don't talk about that in the newspapers or media too much, but it's a huge problem. It's it's a global problem, especially in polluted areas. And where were the polluted areas that we had problems in? In China, in northern Italy, hugely polluted. So, which makes sense, right? So you've damaged your lungs from air pollution. So now that's another factor that goes into, this, list of things that compose your mortality, right? And then another factor was heavy smokers. There was articles about that as well. So if you were a heavy smoker, you are purposely, or unintentionally maybe, but you are purposely sticking a cigarette in your mouth over and over again, damaging your lungs. Well, when you get a respiratory infection, it makes sense that you're going to have a problem, right? So you can add, cigarettes to that. And, so you have all these different factors, and I just mentioned some of them. But when you put that all together, it's like, oh, okay, there's more to this than just a virus and a person. Because there's other things that are actually, the reason that you get sick, the reason you die, which then starts to explain why you have people that are either subclinical or have mild cases, which is, I think it's 80% is the statistic. Yeah. So it starts to explain that. It's like, whoa, I don't understand why these people are subclinical. Well, maybe it's all these different factors, right? And there's probably, more than that. But because we have a virus-centric view and we ignore everything else, and we have media and politicians repeating the same thing about our virus-specific view of reality, nothing else matters. And so everybody's left with this impression that, or most people are, that the virus can strike anybody and kill anybody, and we're all the same because it's a virus, and we have no defense because we don't have a vaccine, we're all going to die. That's just simply not reality. And that goes back to what I was talking about with measles. We've created this false reality.
Wow, thank you. It's very eye-opening
and yeah, insightful. And there's other things that we're just not paying attention to that are part of these numbers. It's how we manage our healthcare system, how we've reacted to it. And in the journal Patient Safety 2013, the article notes between 210 and 400,000 or more patients died due to preventable harms in hospitals. And serious injury is another 10 to 20 times that death rate. So you have every day in hospitals, just normally, just business as usual, between 575 and 1,100 patients dying every day in the United States from hospital, according to this study, because hospital-related harms. It's like, that's huge. Wow. If it's actually over 400,000, that's just such an epidemic. And then you have between 5,700 and 21,000 being harmed because of these hospital problems. It's like,
my goodness.
Did you ever hear about that? Is it on CNN or Fox or MSNBC going every day, oh, another 73 people died at this hospital because of hospital-related harms. Holy, what are we going to do about it? But it's never on anybody's radar because it's, essentially business as usual, right? Nobody pays attention.
Right. Yeah.
And in another study, where's that guy? Okay. Yeah, so this one is 99,000 Americans die of healthcare-acquired infections every year. And so you have 1.7 million Americans develop hospital-acquired infections each year, and basically 100,000 die every year. So here's more evidence that, part of these numbers, because this stuff didn't just magically go away all of a sudden, is, you go to the hospital, they do the wrong procedure, other things happen, there's miscommunication, or you pick up another infection, or maybe you picked up COVID in a hospital, and that you wouldn't have gotten because you went to the hospital. So this is part of the mix, how we manage these things and how we react to them. So if we send lots and lots of people to the hospital in a panic and you focus all these people in there, they're going to get more infections, right?
Right.
So it can become quite the disaster. And there's a lady, brave lady, Erin Olszewski, just massacred her name. She's a nurse. You can find her on YouTube. It's Perspectives on the Pandemic, the Undercover Epicenter Nurse. And she documents how many people came in COVID-free, and they put them all in the same area, and of course they're going to pick that up, or all sorts of very shocking and disturbing things that really happened in this particular hospital. And because I think that was the one where apparently the media was out there and there was body bags outside and all sorts of horrible things. Well, is that because of a virus or because of how we were handling the virus? Did we cause a lot of our own problems? And so everybody should watch this. She's brave, wonderful.
Can you send the link?
Yeah, well,
I'll post it.
I'll give you the link for all these things. Sure.
Great.
And everybody should watch this. And I think that there should be some people arrested and things should be looked at with this. But also in the context of that, this is a pervasive problem in our systems. And if you take those things and things we just talked about and put those into the statistics or the COVID stuff, right? The COVID numbers, and then it's, oh, now we have our healthcare, how we manage things are causing the problem as well, right? Oh, maybe we shouldn't have put them on ventilators, and that caused a problem. There's a lot of nurses who are talking about ventilators were killing people because that wasn't the right way to do it. I have several nurse friends who were talking about that. Oh, wow. And so it's not the COVID problem, it's how we treated the COVID and how people were exposed to other viruses or the same virus and bacteria and stuff like that. So you have these huge numbers, but then how much of that did we cause because of how we did things, right? So again, I think we kind of count these disease deaths in a deeply flawed, and it's just not correct. And then it creates this enormous climate of fear, because if you're reporting measles deaths or whatever deaths and you think that's real, that becomes your reality when there's really all these other things going on. And and the fear alone, you could look at the medical literature, the fear alone is wrecking your immune system. All that fear is causing havoc, which in a natural environment, if you see a bear or a tiger or something like that, your immune system doesn't need to be working then. You want to get out of there. Your adrenaline shoots up and you're ready to go, flight or fight kind of thing, and your immune system is basically suppressed because, well, you don't have to worry about anything. Now you got to get away from that tiger or bear or somebody with a sword or something. I got to get out of here.
Right.
Then once you're free, you relax, your immune system can now function again. You don't have to be pumping out adrenaline. But in our society, it's like, we have this, especially, you watch the media, which I don't think anybody should, just turn it off. Just all it does is like pound fear into you. And that goes for like a lot of YouTube things too. So it's not just CNN and Fox and all that stuff. I actually don't know which one is doing what because I don't watch them, but they did during the Gulf War. They scared everybody to death, so we went and bombed a country based on fear. But
so sad, yeah.
Yeah. So stop watching all this stuff. Stop watching all this negative stuff and terrorizing yourself. You're literally terrorizing yourself by watching these things and not reacting in the appropriate manner instead of remaining calm and thinking about that. And another way to look at this is, all these things that are happening, we're a collective, it's our own collective folly. Pollution, cigarettes, lack of sunlight because we'd like to stay indoors, so we don't make enough vitamin D. We have modern agriculture that we have less magnesium. We're not getting all the nutrients here. We warehouse our elderly. We have large hospitals that are focal points for infection. So we've created this environment where we magnify the problem. So if we didn't have these things and we reacted appropriately, then I don't think this would have been much of a big problem. And I think, actually, I have this somewhere. There's a scientist. What's the guy's name? Where is the guy? Somewhere. I don't know. Oh yeah, okay, so I found him. Michael Levitt. He's a biophysicist and professor of structural biology at Stanford. And in this YouTube video, he's talking about, turns out to be the COVID just a little bit more, maybe 20% higher than the population fatality ratio that was seen in 2017, 2018 influenza pandemic, which nobody panicked over that. So this is just a little worse. And even in the New England Journal of Medicine, March 26th, this is by Fauci, et cetera, they were basically saying, yes, the case fatality rate may be considerably less than 1%. This suggests the overall clinical consequences of COVID-19 may ultimately be more akin to those of a severe seasonal flu, which has a case fatality rate of approximately 0.1%. So, you know, it's not SARS or MERS, it's a lot less, but we reacted in a really panicky way, and we're still reacting like that. We still have places shut down.
Yeah.
Because we're just reacting out of fear. And then once you get the fear going, really hard to stamp out. And yeah, I've been doing a lot of spiritual reading and Buddhism and things about near-death experiences, also so stuff that I've been really reading a lot. And so looking at this infectious disease where you're this person and this microbe is here and it's going to kill us. That's a Western philosophy way of looking at things, right? You're these separate entities. So which basically says we are helpless individuals in the environment. So we're just this thing, we can't do anything about it. But a more Eastern would be is that we're part of the environment. We're all one. We're all together. And actually, when you start looking at all these things, it just makes more sense.
Wow, that is phenomenal. So both drawing from the medical research perspective, and then connecting that to the contemporary situation, and then also bringing in that spiritual outlook and how if we move away from this division where it's like us and the virus and look at things holistically as we are the environment.
Yeah, I definitely think it's more reality, and I think because we're looking at everything through this Western lens, we missed all these lessons that we could have learned from, and we rely on Western magic medicine. And in the case of measles, we 100% rely on the vaccine. We can't do anything else. We didn't learn anything from history. We can't do anything. And that causes this panic. And again, it's that panic has folded into this latest epidemic. People are afraid of infectious diseases because, again, they think we're all going to die. And so we can't do anything else. So they decide, hey, we can't do anything. What are we going to do? Lockdown. Right? Everybody hide.
Right. Yeah.
And I wonder how many people will suffer the consequences of that. Of course, I would think some suicide rates would go up. I think that the stress, the fear will cause heart attacks, will precipitate other infections because you've wrecked your immune system. And you're not getting too much sunlight. So you're not making vitamin D, because I don't know if the media is talking about this, but I doubt they are. Maybe you should be taking 4,000 international units of vitamin D every day to make sure. Well, okay, all right, I'll take your word for it. Which is, it's got the V in it. So if you say vitamin, it's like, oh no, vitamins are quackery. We can't do anything with it. It's really a hormone. It's very important for your immune system. It's involved in a lot of functions. Not that I'm a science expert in that, but I've listened to scientists that talk about that.
Sure.
And so how many people are going to be more deficient in vitamin D, which means they're going to be more susceptible to other infections. And so they'll go out at some point because, well, unless you want to live in your house for the rest of your life, and you finally get exposed to some viruses or bacteria, which human beings are designed to be exposed to viruses and bacteria. We are all the time. It's all over your skin. This whole thing about scrubbing your hands with Clorox, it's probably not a great idea. And, we're designed to live with the natural environment and be part of the environment because we are part of the environment. And as long as we're trying to eat healthy and you know, take some reasonable precautions and, you know, protect the people who are vulnerable because of their situations. You know, I think that would have been a probably more appropriate way to do it. Something along the Swedish model, or I guess a few other countries have done it. And then, you know, I don't think this would have been as much of a problem if, you know, again, if our various politicians and other people didn't react the way they did and warehouse people or send them off to nursing homes and cause spreads of infections and, you know, things that they didn't really, you know, think through too well. So I think if, you know, once we know a little bit more, and again, I'm not an epidemiologist or virologist or anything like that. It's just a simple engineer who looked at all this stuff over decades. So, but that's the way I look at it. And you know, once you do that, the fear drops like a rock. Like, oh, okay, yeah, okay. There's things we can do. There's things that we should change. And then it's like, well, okay, we can do stuff. We don't have to panic. So
Yeah, and so that's the key.
That's my take on it.
Wow, thank you. And I think you really hit it on the head. Just, you know, the fear that they create, that fear mongering, and it makes us, you know, contract, and it just stifles our, you know, immune system and weakens us. And it's just another factor on top of, like you said, being locked in our houses, you know, no vitamin D.
Yeah, just the other day, I went for, you know, I live in a wonderful place. I can just go walk down and walk along the coast. And I'm walking along the coast, you know, enjoying the sunshine and fresh air. And I'm talking to my mom on the phone. And I have my earbuds in. And I see this older gentleman, and he's yelling at me. I'm like, oh, okay, I'll talk to you later, Mom. And I walk over. He walks right up to me. He's got a mask on. He's like, he's visibly afraid. He's terrified. And he's talking about, well, you're all crazy. You're all crazy. I'm like, oh, I said, good morning. How are you?
Right.
Because he's
nice
terrified.
to meet you too.
I'm trying to make him relax. And he's like, why are you all crazy? How come you don't have a mask on? I said, dude, I'm outside. I'm enjoying the fresh air. I was 10 feet away from you. What are you talking about? No, you don't understand. You're spraying viruses in there. You're spraying viruses in there. I said, dude, no, it doesn't work that way. Relax, calm down. He's like, how about if I breathe all over you? And I'm thinking, well, his breath is probably bad. But I said, okay,
Yeah.
I don't mind. And he was surprised by that. And he was like, oh, no, you guys don't understand. You know, we're all going to die. It's a deadly, deadly, deadly virus. And I said, no, it's not. Calm down. I said, your own fear is causing you a lot of harm. You have to relax, calm down. But he was too much into it. He was indoctrinated. Wow. And he was really, really afraid. And he's like, aren't you afraid to die? I said, well, honestly, no. then he kind of lost interest in talking to me. I said, well, okay, you have a nice day. And he wandered off. He was a poor guy. He's been terrified. And I would like to thank all the media for causing this young, older gentleman to be terrified out of his wits. Good job. You did a good job. Now, not everybody is super terrified, but this guy was definitely terrified. And it's unfortunate, because if we had responsible politicians and media, which I guess is probably never going to happen, then that never would have happened, because they could have explained things. But instead, it just they left. And again, I don't watch it anymore. I just kind of hear tidbits. You know, they could have explained things, and people would have been behaving more rationally. And I certainly don't think we would have locked anything down.
Wow.
My opinion.
No, I hear you. Based off the data that you know you've shared, I mean,
and there are plenty of epidemiologists that probably don't appear on TV. I don't know if they do or not, that have the same basic opinion, and they're not even talking about all these other things I just talked about, all the other factors. Just on the raw numbers, you know, they think we should just let things kind of play out. The healthy people should be out, creating herd immunity, and then, you know, make sure we protect the, you know, vulnerable people in nursing homes and stuff like that. What I would add in, you know, make sure they have enough vitamin D and magnesium, and, you know, get them healthy food. You know, I was in the hospital a year ago with my wife, and you know, she would order something off the menu, and it was a quesadilla in this case, and it looked like, when she got it, it was plastic. I was like, who would give this to a human being to eat? what is this stuff? I threw it in the garbage, and I got her food. I mostly made my own food and brought it in because it was so abominable. The horror, it's just a horror food. It's like, human beings shouldn't be eating this stuff. Where did this come from?
Oh, wow.
Man, it's like a plastic factory. I don't know what it was. It's horrible.
Pouring salt on the wound.
Yeah, so we need to rethink how we do all this stuff. And I think if we were more holistic, healthy society, we could sail through these things.
Unbelievable.
But that's my opinion.
Wow. Thank you so much. That was really insightful, eye-opening, and again, just these facts and these studies, really appreciate it.
Yeah. Again, I want people to stop panicking and try to look at things in a more objective way. And I think when you start looking at these things, you can take your fear level down, and then you're like, oh, okay, I don't have to freak out, right? And
Sure.
I like this. I hate to see people all suffering from what they've been going through because of this, and try to have a better perspective on things, and then empower yourself what you can do your own research. That's always important. Don't listen to other people that haven't done their own research tell you things. So yeah,
it's like the blind leading the blind.
Yeah, the talking heads on TV, it's like, you're all gonna die, go home. Okay, I don't know what they're saying, but imagine something along those lines if you boil it down.
Wow, thank you. Great. All right. Well, before we wrap things up, I also wanted to see if you could speak a little about your inspiration, for writing the book. You mentioned how inspirational, your wife, your deceased wife, was in, and how supportive that she was. I was wondering if you could speak a little about that, to give people some of the perspective that you were talking about, how it wasn't just me and Suzanne Humphreys involved in this. There's people in the background.
Sure. Well, I lost my my love last year, August 11th, which is the worst thing I ever had to go through. Of course, she had to go through worse than I did. So, while I was working, and then later when Suzanne joined us, she was always there. She was, reading stuff that I wrote. She was making comments, correcting things. She was always supportive. She cooked the most amazing meals. Wow. Best cook ever. And we loved each other, so we were a team. So although my name's on the book, I probably should have just put both our names on the cover. And I couldn't have done it without her. Well, I couldn't have done it without Suzanne too, but she's on the cover. So so I thank you, Meryl. She was phenomenal. She made it happen. So wonderful. Wherever you are, thank you.
Oh, beautiful. Great. Yeah, and then you also mentioned there's a couple other projects that you're working on. I was wondering if you could speak a little about those projects, so people are more familiar with what you're doing these days.
Yes. So I had been working on an environmental book, started 4 or 5 years ago, because I listened and read some articles, just like I did with vaccines, on various environmental problems. And I was like, oh, I wonder if they're really that bad. Let me just really dig into it. And I think anytime you want to tackle a project, you try to go to ideological and emotional neutral, and just start saying, oh, I'm not going to believe one thing or the other. Let's take a look, see what I find, see where the data leads me. What am I going to find? And not say, oh, I know this is a problem, I know this is not a problem, or that kind of thing. So you have to kind of have an idea of where you're going with that. So or not have an idea, actually. So I started that, and then she got sick, so I kind of dropped it, and I was focused on that, of course. But there was a lot of distressing issues that I started digging into, and I have a book outline. Actually, I have somebody working on me with environmental scientists on that, And there's tremendous problems out that we're not thinking about that are just crazy how bad it could be and what things are really going on. And yeah, if anybody wants, one of these proto chapters, I call them proto chapters because they're not in a book yet. Email me at movingbackfrommidnight, which is the working title for the book, at gmail.com, and I'll send you anything like to. I'll send you all the chapters. I don't care. It's about getting information out. It's not about the book per se. Anyway, so there's a couple of different things like plastics. We're addicted to plastics. It takes decades to centuries for it to decompose, and it's already in our food web. It's in the salt. It's especially in seafood such as oysters and clams. It's in fish. We're breathing it in all the time. We're eating it, and because you get these things into microplastics, and it's magnifying. It's flooding mostly into the oceans because of our poor management of waste. And it just keeps, you have tons of this stuff going in every year. And by 2050, it's projected there'll be more plastic by weight in the oceans than fish, equal to 850 million metric tons, or equal to 2,500 Empire State Buildings, or you can look at it as 550 million cars worth of plastic in the oceans. It's a huge, huge problem. It's killing sea life at a tremendous rate. You may have seen news articles about whales eating plastic and jamming up their digestive system. Seabirds are all projected to be there right now. Most of them have consumed some amount of plastic, and it's projected every seabird will have consumed plastic by 2050. So, and it kills them. It doesn't kill all of them because it jams up their digestive system. They can't tell the difference between that and then some food, and they just get a bottle cap or whatever, and whoop, down it goes. And it's killing huge amounts of life. And we're not really addressing the problem because we're all addicted to plastic. We all want plastic water bottles and plastic forks and plastic spoons and plastic straws and plastic bags. And that stuff doesn't break down, and we just don't bother to clean it up. And so a lot of it ends up in the ocean. And that's just one of the problems. And if we don't take care of it, we're going to really just totally infect ourselves with this plastic stuff. And that'll be a real problem, because how are you going to get rid of microplastics that are less than 5 millimeters or less? It's already everywhere, and it's just getting worse. And because you don't see it, you don't think about it too much. And again, the media is doing a great job. CNN and MSNBC and Fox, we're talking about plastics every day. There would be action, but it's just not talked about a lot. There's been more articles on plastic in the media than maybe other things, but it's still, it needs to be out there, because it's something you can't just go fix later. You can't go out there with a fishing net and just start fishing up all the plastic. It's, the ocean's huge. It's already in the seabed, it's in the Arctic, it's everywhere. Some of the islands on Hawaii, 15% of the sand is plastic.
Oh my goodness.
It's everywhere, and it's getting worse. We're just at the beginning of the tsunami of plastic. We all have to wake up and say, hey, why are we doing this? It's like, it might be convenient to have something in plastic, but it's, overbought. And now with this COVID stuff, I see more and more things wrapped in plastic. Like, that's going to do anything. It's just a dumb idea.
Wow.
And then our clothes, sadly, this is an example of it, is made from plastic. It's nylon or other, and these things don't decompose either. The microfibers are just as bad as the plastic. I bought this before I knew all this. So, yeah, so, we have to get back to more natural things that decompose. Wood, glass is good, that kind of thing. But that's a huge problem.
Wow.
Yeah, another huge problem is overfishing. We love our seafood, because we do, and we have massive trawlers, fishing vessels going around the planet, scooping up everything, so we can have seafood. And already now, 90% of fish stocks over the planet are at maximum or over maximum. They're overfished or they're maximum. So that only leaves 10% that are not overfished or at maximum across the whole planet. So it's a giant disaster because we just keep on fishing more. And the better our technology is, the more we can fish and the farther we can go. And the more technology we can find every fish on the planet with our technology. You know, humans are very clever at destroying themselves. So, and there was a study by Dr. Worm and colleagues that if we don't change our ways, by 2048, most of the fish species we fish will all disappear. There will be a global collapse of fish stocks. That might be a problem. So that's another problem we're not really paying attention to. That's huge. Ooh, I'm getting some feedback. That was weird. Can you hear me still?
Yeah, I can. Yep. Very
okay.
good.
Another one is maybe you've heard of this, the sixth mass extinction, which we're in the middle of. So many of these species across the planet are in steep decline because humans are fascinated with, you know, eating them or just hunting them down for their body parts. So, and we're not really doing that much about it. There are people doing things about it, but as a global community, we're not doing enough. And so even the iconic species, tigers, lions, cheetahs, giraffes, elephants, rhinos, they're all in steep decline. And they're on their target to become extinct by mid-century. You know, we're, you know, in North America, there used to be 50 million buffalo. There used to be 3 to 5 billion passenger pigeons. There used to be millions of wolves and other things. Over the centuries, we mostly decimated them. So, you know, we just don't have as many things here. And now we're doing the same thing to Africa and South America. We're slicing up the continent with roads and technology and people and thinking this is all a great idea. But we're just getting rid of every other life form on the planet. And it's going to be left with humans, cows, chickens, and pigs. And that's it. We're killing off everything else, which we think is fine and dandy because then we have more Kentucky Fried Chicken and McDonald's. Oh, okay, that's fine. But, you know, we're annihilating the biology of this planet. And one study in 2017 used the term biological annihilation to describe the situation we're in. We're causing our own destruction by destroying the entire planet's ecosystem. So that's another thing that's a big problem, huge problem. And yeah, there's a lot of more issues. The Amazon rainforest is probably on its way to collapse, the biggest rainforest in the world, because people being clever decided they can cut down as much as they want to raise beef, look for gold, use the timber. But at a certain point, a tropical rainforest needs enough trees to sustain the transportation of liquid water across great distances. And when it falls below a certain level, it starts to collapse. And we may already be at that collapse point. We're also hacking down other tropical rainforests around the planet. You know, it's all for profit and not a good idea. Long-term, big disaster. It will affect our climate. South America could turn into, you know how Australia has that big dead zone in the middle, essentially. You know, desert mostly. That could happen where the Amazon currently is. It's predicted it might turn into desert or savanna. So it'd be completely different. You still might have tropical rainforests along the coast, but without that giant Amazon rainforest, it will decimate agriculture in South America. So that's another, you know, tiny problem. And we're filling the world with toxic electronic equipment. That is e-waste is a huge problem. You know, we finish with our whatever toy it is and we throw it in the scrap heap, and it's destroying the environment because all those toxins eventually leak out. A lot of places we you know, China's, you know, the big bad boy now, but we've been sending our electronic waste and plastic to China for a long time because, you know, we don't want to clean it up here. You take care of it. But you know, there's a whole town there. I forgot the name of it. It's that's all they do is they hack through all these plastic pieces and stuff like that, plastic electronic pieces, and melt it down and try to extract metals out of it and stuff like that. And of course, you know, people's health is not going to be very good, you know, breathing in toxins and stuff like that. But and then we have glaciers. All you know, mountain glaciers are retreating all over the planet, which we get a lot of water from. So that's another big issue, especially in Asia, where they get a lot of water from there.
Unbelievable.
So there's all these different, you know, really, really bad issues that we're not really paying attention to.
Wow. Yeah, thank you for drawing attention to these. And yeah, I look forward to learning more about the book. And if there's any additional details that you have, you know, definitely please send my way, and then we'll be sure and populate it in the description of the video.
Sure, sure. You know, at some point, maybe you want to even have a full chat about it. And,
yeah,
and depress more people. But there's things everybody can do. I mean, if we don't do them, we're in beyond serious trouble, barring any kind of massive alien intervention or something to help us. But otherwise, we're on our own, you know, try to figure this out. So,
wow.
And I think, you know, everybody needs to do their part. If we get a movement of people making changes, then, you know, that will make an impact. But it's quite a few things to change, and it's pretty radical for a lot of people to kind of grasp. But you know, as we all start to do that, it'll have an impact on what's going on. And as we become more aware, there will be smarter people going, oh, we can do this instead of that, and innovate new solutions and new ways of living, as opposed to the way we've been doing things.
That's been so destructive.
Yeah, and you know, as one guy said, we're sawing off how's that go? We're sawing off the limb we're sitting on, we're perched on slowly, you know. So, you know, we're going to end up in a world of hurt if we don't, you know, address these issues.
Wow. Thank you so much for sharing that. Great awareness, and very, very insightful. So thank you very much, Roman. This was a terrific, great, insightful talk. Ladies and gentlemen, I hope you all enjoyed it. As mentioned, I'll be putting the links and references that Roman had referenced in the description of the video. And you know, thank you once again for joining us. And I hope you all have a wonderful rest of the day.
Thanks very much.